Let's talk about movement. Chronic pain, it can be tough because you're like, man, should I do this? Should I not do this? I'm afraid to get injured. You don't want more pain, I get it. But it's actually always better to start with a little bit of movement, okay, and just assess it from there. Use pain as your guide. But introducing a little bit of friction to especially a muscle belly, and what I mean by that, you have, two joints, right? Let's say ankle over here, knee, and between them, right, we've got the knee joint in the center there. So we've got thigh musculature and then calf musculature right between those joints there. So I'm talking about the muscle bellies in between the joint. We can introduce a little bit of friction there. So self-massage is really big. We could be looking at a massage gun. You probably seen those around. Start with a low intensity and just get a little movement in there. Just get some blood flow going in there. Take it easy, low setting at first. Foam rolling can be very helpful. Although I found you have to be able to typically get a lot of pressure on it. So getting on the ground or on the floor might not be realistic, but if you can, if you're able to get on the floor and get some, for example, get the quad muscle, get on top of a foam roller, that can help a lot. A massage stick, they have the handle look like handlebars here, right? Got a massage stick, got little beads in the middle, that can be helpful as well. They also have things like tiger tails. The crossballs is big, that's just an oldie but goodie there. Just pretty much any round object. I especially like the little therapy balls that have got a ball and it's got little spikes all around it. Those are really cool. And then I've been known to grab dog chew toys, honestly. So I'll just grab whatever, as long as I can get some pressure there. The idea is to, again, move the tissues around, and what we're looking for is a lot of our tissues in chronic pain are glued together, called myofascial adhesions, okay? And they're just locked together. What that means, if that muscle belly won't glide, the ends of that muscle system, which is again is the joint, that's where we feel a lot of pain, okay? But we have to actually unlock the middle of that muscle to allow what's called sliding surfaces, okay? We gotta allow these sliding surfaces. And it's analogous to if you had a bed and you're making up a bed, you've got a couple layers of sheets on the bed, and when there's nothing on top of them, they can glide over each other just fine as you move the covers around. But if we put an object, let's say, we put a brick on there or even sit on it, we create this crazy friction and they can't move very well. They're very stuck. If you ever had that, maybe a couple kids are laying on the bed, you're like, hey, get off there, and you try to move it. That sheet isn't going anywhere. It's just a sheet, right? Well, that friction increased in there. That's what happens in our muscle bellies. So we have ways we can unlock that. And we start with these self-massage tools. Really, really, really helpful, okay? I want to point out that working at the joint, as far as on your own, probably not a great idea. You got to be really careful manipulating and working on tissues of the joint. Wrapping them would be good if you could wrap them up. Sleeves, joint sleeves, things like that. Ace bandages can be good, but I would not put a lot of pressure at the joint tissues unless you've been given, instruction by a practitioner. But again, muscle bellies, the soft tissue you want to focus on at this point. You also have what's called phasic versus hypertonic muscles. Phasic just means muscles that are just completely shut down, do almost nothing when they should, turn on. And hypertonic muscles meaning that they're overactive. So what happens is we have if you imagine a tug of war, we have a big strong person at this end and a weak person at that end, you're always going to get tugged one direction, right? Or they're teeter-totter. Remember that? They remove those from the playgrounds, but we have a fulcrum here, and then our bar up top and the two seats, and then the thing, moves whichever who has more force, right? I want you to think of that when it comes to the joints, okay? The joints have to have equal forces going through them, plus and minus, or they're going to get injured.